My Story, My Journey, Your Awareness, which is aimed at promoting early cancer diagnosis for the population of Wirral and also across tertiary and Merseyside. This is one of the community partnership program between Tertiary and Merseyside Cancer Alliance and local CVS across the region.
My name's Michael Christian and I'm 68. I live now in Wallasey in the Wirral. I am married to my lovely wife Pam, and we have 5 children and 5 grandchildren who live in Congleton.
My name is Nambi Rajan. I'm a consultant urologist specializing in urological cancer, particularly prostate cancer. I've been a consultant in the NHS for the last 20 years. I work in Wirral University Hospital, popularly known as Arrow Park Hospital. Yeah, if you're a man living in United Kingdom, you've got the background risk of 1 in 8, which means 1 out of 8 men will have prostate cancer in their lifetime. And if you're a man belonging to Afro-Caribbean ethnicity, like a black man, your risk doubles, which means the risk becomes 1 in 4. So 1 out of 4 men will develop prostate cancer in their lifetime. So if you have family member who has developed prostate cancer, whether they had a prostate cancer, like your father, uncle, brothers, or a female member of the family, like mom, and if they develop breast cancer, sisters developing breast cancers, then you are at much higher risk than an average person. So you need to think about, if you are in the high risk group, start thinking about your risk and go to your GP and then discuss with them about what the possible tests they can offer to you. So if you have a PSA blood test and it comes back as raised and the doctor has excluded other reasons for the raised PSA, you will be referred to your local urology department. The urology team will assess an MRI scan, magnetic resonance imaging. It's just like you're having a CT scan, but a little bit more sort of close to your body. And it's a very easy test. It's a non-invasive test. There is no pain associated with that. And that scan gives us more information about what is going inside your prostate. And depending on what changes we find inside the prostate, the urologist will advise you to have a biopsy. A biopsy is a test where you put in a needle into the prostate and take a piece of tissue to find out what's going on. This biopsy is usually done under local anesthetic, meaning you are not put to sleep, you will be awake. They will give you something to numb your skin and the prostate and put a needle in the area we see the change in the MRI scan. So we can specifically do what we call as a targeted biopsy, and we will know exactly what's going on.
5 years ago, I'd heard of it, but never considered it, didn't know anything about it. And it was actually through my brother Martin, who lives in Nottingham. He was given a complete health test by his new GP, and that showed up that he'd got an aggressive form of prostate cancer with a high Gleason score and a high PSA level in his blood. And one of the things that he said to me was his doctor had asked if he got a brother or brothers. And he said, have a word with them, get them to have a test as well, because it is a hereditary condition. So I went to my GP, having had no symptoms myself, and they came back saying yes, there were the signs were there. There was the beginnings of prostate cancer. And he said it's not aggressive. They gave me a Gleason score of 6, and he said that could stay like that for a number of years, You don't have to do anything now. Or you could have hormone treatment followed by radiotherapy, or you could have surgery to have the nasty bits removed altogether. And my initial thoughts were not to have surgery. The doctor seemed to say surgery was not the ideal option. I was going to have it monitored on a sort of wait and see basis, because he did say I could be all right for maybe 20 years with nothing happening. Well, I'd definitely say if you've got a family history, then have the check. A blood test is so easy and quick, and it will signal whether you've got a potential problem or not. And over the age of 50, again, that increases the risk level. So you know, it's far better to find out early than leave it too late.
Start thinking about risk of prostate cancer if you turn 50. If there is any history of prostate cancer in the family, or breast cancers in the female member in the family, or if you are a black man, your risk is higher. So go to your GP, discuss the pros and cons of having a PSA blood test so you can make an informed decision. If you have any urinary symptoms, please don't ignore them. Go and discuss with your GP, and they will be able to advise the necessary tests that you need to undergo. Early detection of prostate cancer saves lives. So the earlier you approach your GP, it is better for us, and we will be able to offer lots of different treatment options, and thereby we can reduce the side effects.